Imagine a virus so deadly that entire villages fall silent within days. A disease that spreads through fear, panic, and human contact. A virus that once terrified the world during the West African epidemic of 2014. And now, in 2026, Ebola is back in Africa once again. This time, the outbreak involves a rare strain called the Bundibugyo virus, spreading across parts of the Democratic Republic of Congo and neighboring Uganda. Hospitals are overwhelmed. Healthcare workers are among the dead. And global health agencies are racing against time to stop another catastrophe. But what exactly is Ebola? Why is this outbreak so concerning? And could the virus spread beyond Africa once again? This is the story of Ebola's deadly return. Welcome to my channel Info Rush with SK, and this is SK. Ebola is one of the world's deadliest viral diseases. It belongs to a group of viruses called Orthobola viruses and was first discovered in 1976 near the Ebola River in what is now the Democratic Republic of Congo. The disease spreads through direct contact with infected body fluids, including blood, saliva, sweat, or contaminated surfaces. At first, symptoms may look similar to the flu: fever, headache, muscle pain, and weakness. But within days, the illness can become severe. Patients may suffer vomiting, diarrhea, dehydration, organ failure, and in some cases, internal and external bleeding. Ebola outbreaks are especially dangerous because the virus spreads rapidly in communities with weak healthcare systems, and healthcare workers are often at the highest risk. Some Ebola strains have fatality rates as high as 80 to 90%. But not all Ebola outbreaks are the same. The current outbreak is caused by a rare strain known as the Bundibugyo virus, and that changes everything. In May 2026, health officials in eastern Congo began receiving alarming reports. Clusters of unexplained deaths were appearing in remote communities in Ituri province. Some victims were healthcare workers. Others died before doctors even understood what disease they were facing. Initial testing created confusion. The virus was difficult to identify, delaying the emergency response. Then came the confirmation. The outbreak was caused by the Bundibugyo strain of Ebola, one of the rarest forms ever recorded. Soon after, cases appeared in Uganda. One infected traveler from Congo died in Kampala, raising fears of cross-border transmission. By mid-May, the numbers were rapidly rising. The World Health Organization reported hundreds of suspected cases and dozens of deaths across affected regions. And then the world took notice. On May 17, 2026, the World Health Organization declared the outbreak a public health emergency of international concern. That is the World Health Organization's highest level of global health alert. The organization warned that the outbreak could spread further across borders due to regional movement and fragile healthcare systems. The Democratic Republic of Congo has experienced many Ebola outbreaks before. But this situation was different. Why? Because there is currently no approved vaccine specifically designed for Bundibugyo strain. And that means doctors are relying heavily on isolation, contact tracing, protective equipment, and supportive medical care to save lives. Meanwhile, the CDC in the United States announced enhanced screening for travelers arriving from affected countries. International agencies are now working around the clock to contain the virus before it spreads into major cities and neighboring regions. Eastern Congo faces enormous challenges even without an Ebola outbreak. Years of armed conflict, displacement, poverty, and weak infrastructure have already pushed healthcare systems to their limits. Many affected areas are difficult to reach. Roads are damaged. Medical supplies are very limited. And fear spreads faster than reliable information. This makes tracking infections incredibly difficult. Health experts also worry that the actual number of cases may be far higher than official reports suggest. Some patients avoid hospitals just out of fear. Others are treated at home, increasing the risk of transmission among family members. And because Ebola spreads through physical contact, traditional burial practices can unintentionally accelerate outbreaks. Healthcare workers face another major risk. Several medical staff members have reportedly died during the outbreak, highlighting the gaps in protective equipment and infection control. Even more concerning is the appearance of cases in urban centers like Kampala and Kinshasa. Once outbreaks reach densely populated cities, containment becomes far more difficult. And that's exactly what global health officials are trying to prevent right now. Whenever Ebola appears, one question quickly follows. Could it become another global pandemic? Experts say Ebola is very different from viruses like COVID-19. Ebola does not spread easily through the air. Transmission usually requires direct physical contact with infected fluids. And that makes Ebola easier to contain than any other airborne diseases. However, the virus is still extremely dangerous. Even a small outbreak can overwhelm local healthcare systems. And international travel means infected individuals can cross borders before symptoms become obvious. And that's the reason countries are increasing screening measures and monitoring travelers from affected regions. Health agencies currently say the risk to the general public outside affected areas remains very low. but the situation is being closely monitored because history has shown that outbreaks can grow rapidly if early containment fails. The world still remembers the devastating Ebola epidemic in West Africa between 2014 and 2016. More than 11,000 people lost their lives during that crisis. Entire communities were traumatized. Healthcare workers became symbols of courage as they risked their own lives to treat patients. That outbreak changed global public health forever. It improved surveillance systems, emergency response networks, and vaccine research. But the current outbreak shows that the fight against Ebola is far from over. New strains continue to emerge. Healthcare systems remain vulnerable, and global cooperation is still essential. Scientists are now urgently studying possible treatments and vaccines for the Bundibugyo strain. Until then, the most powerful tools remain rapid response, public awareness, and international support. The Ebola outbreak in Congo and Uganda is more than just a regional health crisis. It's a reminder of how connected our world has become. A virus discovered nearly 50 years ago still has the power to challenge modern medicine. And while scientists race to contain the outbreak, ordinary doctors, nurses, and healthcare workers continue fighting on the front lines every single day. Their battle is not only against a virus, but against fear, misinformation, and time itself. Because in outbreaks like these, every hour matters, and every life matters. So friends, what do you think about this Ebola outbreak? And how do we prevent this Ebola outbreak turning into a COVID-like situation? Leave your comments below. See you in the next video. Take care. This is SK signing off. Bye.